Honorable Indian Minister of State, to Madam Patel, Mr. Gupta, my colleague in the ministry, Mr. Sharma, and friends. Before we speak and before we discuss anything about the healthcare system and what is the role of technology and medical devices and all that, I think we must talk about the actual conditions which prevail and the various challenges that we face day in and day out in this country, in the field. You'll be knowing, like this comes often down in the newspapers, that in the rural areas we don't have doctors, and there are many challenges. If you look at the global, the burden of diseases which are there, we have the NCDs coming up with a vengeance, contributing to 60% of the total mortality and total morbidity. And this happens in any country which is kind of developing economically. Now with that, I must tell you what exactly is being done in the ministry, what are the challenges, and how this kind of a dialogue is going to be extremely useful. And it's going to help all parties. It's going to be a win-win situation, not just for the industry, you all are present here, but also to the government, and finally, I would say, to the common man, who really deserves the best. Now, I don't know if you have noticed, our Honorable Finance Minister in the last budget, he announced that many of you might not be knowing, at least our friends from abroad, that in this country, basically healthcare is a subject which is handled by the state governments, as per our constitution. And the government of India actually sort of does the handholding and gives them whatever helps them in training, capacity building, and also gives financial assistance. And that's the kind of framework that we have. Now, if you go to states, there are huge differences if you go from one state to another. Even though the government of India, under the National Health Mission, tries to help those states which have more problems, more population, more backwardness, and all that, there's an inbuilt mechanism. But still, you will find huge differences, interstate, intrastate differences. And if you go to rural area, then there are differences. So whenever we are having a dialogue, I think we should be mindful of that particular fact and what are the challenges and what can possibly be done. Now in the last budget, it was announced that the lowest level of service delivery system, which is called the sub-centers, we have these big hospitals, medical colleges, then we have district hospitals, then we have sub-divisional hospitals, we have community health centers, and we have primary health centers, then we have sub-centers right at the ground level. And we have 1.5, little more than 1.5 lakh. A lakh is 100,000 for those friends who are from abroad. 1 lakh is 100,000. So we have 1.5 lakh, 1.55 lakh to be precise, sub-centers in this country, where essentially which provide maternal and child health services, immunization and things like that, antenatal checkup and things like that. And we have what's known as an ANM there. Now, the big game changer announcement which has come from the present government is that these 1.5 lakh sub-centers are going to be converted to what's known as health and wellness centers. Now, what does that mean? It means the number of services are going to be much more comprehensive. And we are going to have mid-level service providers, not just an ANM, but we'll have other people, like an Irish doctor, or a nurse practitioner, or a BSc, somebody who has done a graduation in community health, that kind of thing. So to cater to the needs actually of the people, not just the maternal and child health, but other requirements as well, including the NCGs, maybe mental health, maybe geriatric health. So this is going to be a huge game changer, I would say, in the coming years. So what does that imply? That implies that they are going to use a lot of technology, a lot of digital tools, a lot of your inventions, your discoveries. So that is the kind of thing that you must look at. That here is an opportunity where the industry can really come together. I mean, not just industries in this country, and there will be obviously going to be a huge competition because the kind of the volumes that we are talking about are going to be much more. This is one. Number two, there is another huge thing which has already been started, and this was my dream actually when I joined in this ministry a long time back. It was in 2010. I had been thinking of this, but now it has become like, it has actually come to the table, which is now we are going to start the screening for 5 conditions of NCDs to start within 100 districts in this country. It's going to cover the entire country. Hypertension, diabetes, and 3 common cancers: oral cancer, breast cancer, and cervical cancer. So that is going to be again a game changer in this country. In the public health facilities, when you do the screening of 30 years plus people on a universal basis, on a population-based screening, not opportunistic screening, population-based screening, it's going to really create humongous amount of awareness building amongst people. They are going to again use technology, they are going to use medical devices. So that's again an opportunity for all of you to contribute to this huge cause. Now, when you're talking about other things, my colleague Mr. Sharma just pointed out some of them. I'll just tell you one little thing, amongst many steps that the government of India is taking. We have started what's known as Anmol. Anmol, some of you who know Hindi, what does it mean? But here, Anmol means ANM online. Now, what's being done basically, that we want that we have under the MCTS, Mother and Child Tracking System, we have data of 24 crore mothers and children already with us. And this is, 10 million is 1 crore. I mean, for you especially. Sometimes, we kind of get confused, what's this crore and lakh business in India? 24 crore already data with us. Yes, and I'm just finishing.
No, it's okay.
Because when I see somebody coming to me, when I speak, I think they are coming up with a chip that, better finish fast,
No, that's okay.
So, okay. But please let me know. I'll just finish it. Anytime you want, I'll finish it. Mr. Gupta wanted to say something?
I want to say you continue, we want to hear you.
Okay. So, now, this Anmol, it's quite interesting, where an ANM in the field is given a tablet, okay? And obviously, when we are talking about tablets, when we talk to somebody, he says, what's tablet? I mean, why do you give a tablet to the ANM? I mean, it's not obviously the other tablet. So, when we're giving a tablet to the ANMs and giving them training and all that, the ANM is trained to actually punch in a lot of data which comes to the server here, and it generates lots and lots of reports. Now this is going to be huge. And similarly, we have something called Kilkari. Many of you might not be knowing. We are sending 78, mind you, 78, 26 before delivery and 52 after delivery, weekly messages to the mother or to the would-be mother, telling her through a mobile phone what exactly needs to be done. Take your child for immunization. Do this, do that, take this shot. This has been done. Crores and crores and crores of messages are going for Kilkari to all these to would-be mothers and mothers. And this is phenomenal. I mean, if you really come to see, this is creating a huge amount of awareness building, and it is contributing to the health-seeking behavior of the people. You will find one of the biggest challenges that we face in this country, that many people in many areas, especially those who really need to go for healthcare, actually do not have that health-seeking behavior. That's one of the biggest challenges that we face. So these are some of the things which, I don't want to really take much of your time, but similar things are being done in the ministry. Now, why do we need, when we're talking about technology, the other day, something came to my mind, technology actually does three things, at least three things, we can write it as eat, E-A-T, or we can just write it as tea, T-E-A, we all like tea. So I was just thinking of, what does this do? This technology, what does it do? I believe the first T, if you take T, the first T is transparency. Many people just don't know what's going on. What is going on inside this room? I think technology really helps us in a country like ours, transparency. And what is E? I believe E is empowerment. It empowers people, tells them what are their rights. And what is A? A is accountability. It holds people accountable, holds people like us, people like me accountable. That you need to really, you better do this. And increases the health-seeking behavior or whatever, or the rights-seeking, enforcing behavior of the people. People come and say that, look, we are supposed to get this. Why are you not doing it? And that's something that technology has, that tremendous amount of power and potential to help in that regard. Now, when we are talking about this kind of, I was looking at the government-industry dialogue. Why do we need a dialogue like this? I think we really need a dialogue like this because both parties win, both parties benefit. The government benefits because you all tell me what kind of things are on the horizon, are on the table, right from Continua up to like many things which will come here from you. The government must know. Now, how does the industry benefit? The industry must know what is government thinking, what are the requirements, what are the felt needs, actually amongst the people. That is why this dialogue is important. Now, when we are talking about all this, I am thinking of three things. One, the National Health Policy. I don't know how many of you have gone through the National Health Policy, which was recently announced, approved by the government. And this is, believe me, this is a landmark policy. Please go through it if you haven't. It will not take much time, Just very thin, thick, not a very thick, big policy. It's quite readable. When we are talking about National Health Policy, it actually tells you the vision of the government. That what does the government is looking at or looking towards. And then there are two things which I'm always reminded of. That Make in India is a big slogan that you must all be aware of, that Honorable Prime Minister has been talking about. And Digital India. So Make in India and Digital India. So when I was sitting there and Mr. Deshpande was talking about that, I thought, this Make in India stands for M and Digital India stands for D. How do we connect this M and D? We can connect it only by A, which is affordability. So unless and until our digital tools or our manufactured goods or medical devices are affordable in this country, we are not going to benefit from that. I remember around 3 years back when I was handling drugs division in the ministry, around 4 years back. Hepatitis C was a huge problem, continues to be a big problem. But hepatitis C drugs, which that time used to be imported from US, from the innovator company, used to be absolutely unaffordable. So were the drugs for HIV some time back. But our industry, our people, pharma industries, they came up with some magic. The prices of the drugs, the cost of the drugs came down like nobody's business. Just like, it didn't have a meteoric rise, it had almost a meteoric fall. That kind of a fall. And now, they have started becoming affordable. So my request to all of you would be, you may come up with the best possible solution to a problem, a device or a technology, unless and until that's affordable. That's not going to break ice. That's not going to be acceptable by the government or by the people, or it's not going to be useful at the grassroots level. We must remember in India, it's volumes. Volumes are important. Margin will be very less. I have been telling all those people that look, when you come to India, you have to pay differential pricing. Look at the volumes, don't look at the margin. So affordability is a huge thing. Of course, quality is there, but affordability is an extremely important thing. If you can put that A between M and D, I think we all will be mad, and we will all be mad about all this. Thank you very, very much for your time. Thank you.
Thank you, sir, for letting us know new terms, that is T stands for transparency, empowerment and accountability, and we all are going mad, making India affordable through Digital India. I would now like to request our chief guest, Mrs. Anupriya Patel, Union Minister of State for Health and Family Welfare, to share her views.